Now we'll move on to aerobic exercise. This was a picture. I'm the director of the Ironman here in Arizona. This was actually the winner of it. So this is actually locally. Dr. Grohar Murray looked at describing self-care actions used to manage fatigue in MG. 250 patients. They did a fatigue survey and MG-FS. The results will focus in on the physical, which was 78%, and there was a subset that had 36 out of 250. Most of the top percentages were seen in activities of daily living. I do want you to point out, though, that in low-impact aerobic exercise, swimming, walking, running, 20% did utilize that for their fatigue. And of that subset of populations, 2/3 said it actually improved their fatigue, and 1/3 no relief. Coming up lastly here, respiratory training. Again, it's been very well received. This decrease in respiratory strength endurance has been established in patients with MG. Deterioration in respiratory musculature causes changing in breathing patterns, which increases morbidity and mortality. So it's thought that inspiratory muscle training may be utilized using and I underline it as interval. I think that's going to be a key in our prescription at the end, based training principles. And so that could absolutely help respiratory strength and mobility and endurance. This is one study that came out last year in chest. Again, I think there's a lot of studies on respiratory training. 27 patients with generalized MG were randomized to a control or training group. They underwent IMT associated with diaphragmatic breathing and pursed lip breathing 3 times a week for 8 weeks. And the sessions were 10 minutes each of the breathing, IMT, and the placebo group. So they split them up. And they consisted of training interspersed with recovery time. The threshold was increased up to 60% over 8 weeks. If you look at the respiratory strength and endurance, you can see that the training group did have some significant improvement, as well as the mobility and the chest wall in both expansion and reduction. So the conclusion is that there's possibly a mixed aerobic and anaerobic training effect related to the intensity and frequency in favor of that. The limitations, it was a small sample size of the study. It represented only about half to 70% of the total MG group. But there were positive effects I think you can draw out, including chest wall motility, respiratory pattern endurance, but the improvement in lung function was not seen. Lastly, myostatin inhibitors. This is another medication. I'm associated with the International Society of Sports Nutritionists, and last year University of Pennsylvania researchers were talking about myostatin inhibitors in neuromuscular disease. What it is that if you see, it's a gene that some people have, some don't. You'll see somebody that's extremely well developed that does not have the myostatin. So what happens is it has an effect on muscle hypertrophy if you do not have it. So myostatin deficient animals are achieved by genetic engineering. I have a great slide on the next slide after this. But there's a lot of claims, and actually the supplement industry is already, if you understand the supplement industry, it's a dog-eat-dog world. And they try to already make claims and produce these pseudo-myostatin type of supplements. A number of different claims that say it's going to increase your muscle mass. And you can see on the right, that's a genetically engineered cow. And on the left is a lab rat that you can see the top is with the myostatin deficiency on the bottom, and on the top is without it. A couple studies a few years ago, 37% decrease in myostatin after 9 weeks of training. So that helps improve muscle hypertrophy. Individuals with larger muscles showed they have greater decreases in the myostatin RNA, or the genetic sequence, after up to 24 hours after exercise. So this is something that's in its early stages. So in conclusion, a lot of recommendations that I can make, but it's limited. Number one, adapt a healthy lifestyle. There's a lot of benefits that you can get, whether you have MG or you have a concomitant in other disease states, or just if you want to remain healthy. I think it's very important to remember you're a whole person, not just MG. Moderate intensity exercise is probably going to help out in modest exercise. Strength, the disease state is not too severe. Again, I can't comment I can only use common sense, but if you have a very severe MG and you have frequent exacerbations, that's probably not going to be as beneficial. Modest aerobic training is recommended, even though the improvements are difficult to quantify because aerobic capacity is usually rarely limited in activities of daily living. So we're really not getting up to some of those high levels of the VO2 max and some of the oxygen consumption cases we were talking about. MG will have a variable response to training, depending upon the degree of weakness, fatigability, and level of deconditioning. Again, the fatigue may be reduced by brief work-rest interval training. And I think the key word is intervals, so frequent intervals is important. The quality and the quantity of evidence in individuals with MG was limited. As we talked about, that's pretty much the data I can gather. But most of the evidence is from studies that were non-randomized, observational studies and case studies. So, as far as creatine supplementation, it could be considered as a standard of care, but there's a lot of further investigation that needs to be done. So, I do have a couple patients with MG and exercise. I have them on it. I think they tolerate it well. I don't think it's the be-all, end-all. I think it's part of the pie, not the whole pie. Morning workouts, cooler environments may offset some of the adverse effects. Hydration is very important. Understand the deleterious effects of the immunosuppressants and the medications that MG provides on exercise and the neuromuscular system. And then the three components of exercise: frequency, intensity, duration. When you start an exercise program, I think it's important to do frequency, 5 to 6 days a week. Low intensity, duration should be short, and increase that gradually. And increase your intensity as you can go. So start low, go slow. Just to kind of what we do in our sports medicine, I'll have to say, I mean, this is sort of a de novo type talk where there's not a lot as far as research-wise, but we looked at, if you look in sports medicine with anterior cruciate ligament reconstruction, that's where you have a knee reconstruction, and even in sports hernias have evolved. An ACL reconstruction, you used to get, if you had a knee injury 20 years ago, you'd be in a cast for 1.5 to 2 years. And what actually happened was, and this is a true story, what happened was there was a non-compliant patient that cut his cast off about 10, 15 years ago. They found he did really well. And now ACLs are being reconstructed and return to play is as quick as 4 to 6 months. So I'm not saying to turn your head on medicine, but you know, I think occasionally it's nice to have a cowboy and a rebel to help guide the way. Same with sports hernias. So quicker recovery. So that's my mindset. Every day if I have my athletes, if they get hurt, they want to go back the next day. When can I return is the question. So I think if you take that approach with MG, when can I get back to exercising? I think it starts out with the mind, the body connection. I think I'm very in tune with the mind-body connection as far as being a healer. Don't underestimate the willpower and perseverance and persistence of one. And then I have this arena quote. It's by Theodore Roosevelt. It's on the back of all my business cards, but I think it's a very strong quote, and live that life as you can read this quote. So thanks for your attention.